Hey everybody, Coach Justin here, or maybe assistant to the coach Justin. Joining me today is Sandro Martin, and he is an awesome CF advocate and also patient. And this is the first part of a two-part series. And today we're going to just ask Sandro, Coach Justin's top 5 questions to learn about the life of a CF patient. So, Sandro, welcome.
Thanks for having me, Justin. I really appreciate it. I'm super excited to share a little bit of my story. And yeah, like I said, I really appreciate you having me on, and let's get started.
All right. So question number 1, what is your one word that guides your CF patient journey?
Well, Justin, I would say the one word that I would use to describe my CF journey is body, or body whisperer. And
Yeah.
that's because, a lot of CF patients have so many different issues that range across all different organs. So for me, uh, growing up and trying to be an athlete, I had to listen to my body every step of the way. I've had problems with my blood sugar, so I've messed around with carbohydrates. And I did so at one point in my life so much that I would drop down to below 40, which if you don't know anything, you want to be within 90 and 110.
Yeah.
That's pretty low. And I'm at risk for having cystic fibrosis related diabetes. So I'm not on insulin, but I was thinking to myself, like, what's going on? I would crash, I would drink orange juice and be fine. But I came to realize, like, okay, my diet, I'm messing around a little too much. I'm having too much sugar, too many carbs, too prematurely. And so I had to listen to my body. My body was telling me, like, stop doing this, educated myself a bit more, and I fixed that. The same thing goes for my digestive system. So, I would go to restaurants and have greasy, breaded, like foods that, normally you can't really digest anyway. It
Right.
was
Like, what's the point of exercise if you can't have a giant hamburger, right?
exactly, that's very true. Like restaurant foods are triple the amount of calories. So I was like, oh yeah, I'm going to eat this and I'll digest all of it. And that was not the case. So I figured out a big range of foods that I definitely stay away from. And thank you to my body for telling me that. And then for a lot of CF patients, you begin to cough more, you feel like a cold coming on, you're going to increase your treatment. So that's how I'd relate it to most CF patients.
So I think you really touched on, something to start us into our next question, and that's what's one thing about having CF that people might be surprised of?
Yeah, I definitely did touch upon that. It's that CF, you look it up and you'll see that it's a lung disease. That's the first thing you're going to read. And that's not everything that CF will affect, because it affects the cells that produce the mucus. It makes mucus extra thick and sticky, not just your lungs, but the ducts in a lot of your different organs. So I would say you're going to be surprised to find out that a lot of CF patients, they have GI issues, digestive issues, reproductive issues. And yeah, so that's something that a lot of my friends and family were like, oh, I thought it was your lungs. Your lungs are messed up.
Yeah.
Well, quite frankly, my GI is just a little bit more messed up than my lungs. So we're all different.
Yeah. Well, okay. So tell me, what was your toughest moment as a CF patient?
Well, there's a lot of tough moments. The hospitalizations, they were not so tough compared to this moment. I think for me, the toughest moment was about 10 years ago. I was 13. I had an iPod, unrestricted access to the internet. So for the first time in my life, you know, before that, my parents would handle the medications. They'd handle the doctor conversations. But I was 13 and I was like, oh, I have CF. It's pretty interesting. I'm going to read about it. And I came across a YouTube video that shared two things that I didn't know. One of them being the reproductive issues. So 97% of men are infertile. And reading that, I was like, oh, I'll never be able to have a natural child, which is untrue. We can do it unnaturally with a small procedure. So that turned out to correct itself. The second one was the shortened life expectancy.
Yeah.
So I read about that, it was 38. And I remember sitting at the dinner table at 13, I just read about it. And I'm sitting there just like, I don't know, I guess shocked. I don't really know what to think. But as we know now, that's 38, maybe for people that are 38 now, it's unfortunately didn't have access to the incredible treatments that we have access to now as younger folk. So, that as well is a bit untrue for, I would say, a majority of the community. A lot of us have begun to take drugs like Trikafta, which treats the cells instead of the symptoms of CF. And that is absolutely changing the life expectancy. Just like when pancreatic enzymes came out for the first time. I mean, it made the life expectancy jump. So, yeah, a shorter life expectancy, but I would say, Justin, not 38, not for me. I feel too healthy, too fortunate to have the drugs that I have. So, we're going to shoot for a lot higher than that.
I just can't imagine, trying to process something like that at the age 13, right? That must have been really very difficult.
Well, I remember it to this day, but it humbled me a lot, and I wouldn't take it back because I appreciate life so much because of that. So,
well, let's pivot to something a little bit more positive. What is your best moment as a CF patient?
The best moment, I did just talk about Trikafta. I would say it's getting Trikafta. I remember, like, anytime they came out with a new drug, I was like, okay, great. Now that's just something else for me to take. It's going to be a massive burden. But, taking Trikafta the very first time, I'll never forget that either. It was like the best feeling in the world. And I've seen it. My pulmonary function tests, I'll toss out some numbers. My small airways were dipping. I would be walking upstairs and I'd be out of breath a little bit. And I was like, dang, this is it. Like, I'm actually going to start to feel the decrease in lung function.
Yeah.
Trikafta has pulled me up so much, and I don't even cough at all anymore. A lot of CF patients will tell you, like, I went from coughing every day, bothering people, to coughing being an anomaly. So that is the absolute best moment. And I'm sure I'll have even better moments to come in the next few years.
Oh, that's so awesome to see. All right. So what's something you've accomplished that, let's say, 3 years ago, you would have thought would never happen?
Yeah, I love this question, because one of the most embarrassing things for me, I would say, is I need to have a bathroom somewhere nearby. It's just that's like an embarrassing topic for some people. Yeah. It's the reality that I want my privacy. I want to be able to use a restroom and not have to worry about, where that restroom's going to be. Is it going to be in a Burger King? So I would say something that I thought I would never be able to do is study abroad. So I majored in Spanish and international business, both of which require you to do a study abroad. And going to college, going to high school, those transitions were scary for the sake of, just some of your symptoms, you want to be home in the comfort of your home to deal with. So studying abroad, I was like, how am I going to get all of my treatments? How am I going to get my vest? How am I going to be comfortable? But quite frankly, I did all that. I brought a lot of luggages, one of which was packed to the top with medication. I had a fridge waiting for me in my dorm, so I was able to refrigerate some meds. I literally brought my Monarch with me, in planes.
Wow.
And I don't want to joke about anything, but they never unzipped it to take a look inside.
Oh, jeez.
If they had, they might have been a little concerned. It's it's a big bulky vest.
Yeah.
So,
Jesus.
But we just slapped a medical device label on it, and that was fine. So, fortunately, I was able to go abroad, and it was the best experience of my life. Very grateful.
I mean, that's a great story. I think that's gives some people some great framing about how things are changing, and how patients aren't just surviving this disease, they're starting to live. And it's based on all the work that all our volunteers and fundraisers, and most importantly, the work that you've done of just really doing what you need to do around your disease. It's so inspirational.
Thank you, Justin. I really appreciate that a lot.
Well, this was a great segue into our first segment of just learning about you as a CF patient. Coming up soon, we're going to have a second segment. We're going to dig in deeper and find out about Sandro, the person, not just the patient. So come back and see us soon.